Next up, we have Commissioner Christian. In 2012, Clayton Christian was hired as the Commissioner of Higher Education for the Montana University System. MUS encompasses 16 public colleges and universities within Montana, while serving more than 42,000 students and roughly 2,500 faculty. He's worked in the education field for more than 10 years, and he joins us today to share his knowledge as he and his team navigated returning students to campus this fall amidst the COVID-19 pandemic. Commissioner Christian, thank you for joining us tonight.
Thank you, Brandon. It's a pleasure to be here.
Absolutely. So having been involved in conversations regarding the best approach to the pandemic from an educational standpoint since it reached the US, and ultimately switching to a totally virtual learning model in the spring, how have things progressed from the Montana University System's point of view to allow students to return to campus?
Yeah, thank you for that. And you know, this is all a bit of a moving target, and we adapt and we change. I think, as you said, you know, we started back in January, formed a task force at the MUS level, which at that time was essentially to sort of monitor what was largely an overseas problem at the time, right? And it rapidly hit our shores, and we have adjusted accordingly. I think in March, there was just a lot we didn't know. And I think that really played in the decision to move everything remotely and to do so fairly quickly. We also did it right before we had 45,000 students across the MUS headed to spring break. And we just felt like going to spring break and then bringing everybody back to campus posed some risks that weren't warranted. But so I think we made that decision, and I don't look back on it. I mean, I think that was the right decision for the time. But, you know, I think as a country, certainly as an institution, we know a bit more about the disease now than we do then. We know that it's incredibly problematic, but handled appropriately, we have a shot at trying to manage a population and keep students as safe as possible, and the faculty and staff that serve them. And so we're working to that end, and we've had a group involved really since the remote learning in March. There's a healthy fall task force that was started up, and that encompasses people from leadership roles at every campus to the logistical registrars, people that have to sort of organize this. And we've really worked through plans to change how we do business. And I think ultimately we're very hopeful that we've reduced class sizes, we've spread people out, we've broken sections into multiple sections. We have classes built for 100 students that now have 30 students in them, so we can socially distance, so we can do all the things that we need to do. And, you know, to move to that scale over the course of the summer was a pretty significant logistical challenge. So we've been active in moving that way. But I don't profess that we know all that this pandemic has to offer, because we probably don't, but we know more about it now than we did. And I think it creates some amount of comfort that if we can manage our institutions properly and we get cooperation from the individuals that we serve and those serving, that we have a shot at a healthy return this fall.
Yeah, absolutely. Well, you mentioned the MUS coronavirus task force. I'm curious, what were the biggest challenges or factors that your team faced while planning the safest approach to return students to the classroom?
Yeah, that's a good question. You know, one of the challenges I think we have always at a system level is that all of our institutions are not nearly the same. We've got everything from two-year education to postgraduate doctoral research happening at MSU and all the above. So we're not in a situation where necessarily one size fits all, but at the same time, we don't want 12 or 16 different institutions doing things completely different. And how we're going to handle the message around those was really kind of a logistical challenge. How we could build some guidelines that fits most. And ultimately what we ended up doing is create a document that's very overarching, saying these are the 7 or 9 areas that you need to look at, that you need to concentrate on in terms of keeping students safe. And then how you do that really needs to fall to a campus level. So it's sort of a two-step process. We created these overall guidelines, and then we handed it back to the campuses to try to implement their version of what was said in those guidelines, if that makes sense.
Yeah, it definitely makes sense. And on the topic of implementation, obviously, planning versus the carrying out of a plan are two different things. But in your opinion, what are the key factors to maintain student health and well-being while on campus?
Well, yeah. Well, I got to start with probably the number one, and this isn't an easy one. And some have even sort of characterized it as blaming the students or anything else. But to be honest with you, student behavior is going to have to represent a huge part of this for us to be successful. What we've seen around the country in institutions that have tried and it hasn't went well is the students really haven't participated at a high enough level in the solution. And that's not blaming, it's just the reality that we need students to maintain that social separation. We know they're excited to be back on campuses this fall, but it's going to have to be different than it's been in previous. We'll have to have moderations around gatherings and group sizes and interactions. And we need a lot of help there. And I think if we can get help from students and they take that serious, that's kind of the only path forward. We've put a lot of the precautions in place, splitting up classes. I have no idea how many linear feet of plexiglass we've installed over the summer, but it's significant. I mean, we went through the processes. We're monitoring temperatures. We've got all the things suggested by the CDC in terms of hand washing stations, the rest. But none of that makes any sense if nobody uses it and if we don't maintain social separation outside of the classroom. And people talk a lot about campus environment, but 70% of our students live off campus. So how they maintain themselves off campus, and that's not just students, it's faculty, staff as well. We all have to sort of participate in this goal to be back to a face-to-face learning environment.
Yeah, definitely. And at the end of the day, we're social beings for sure. And there's been a lot of studies going on regarding the pros and cons and mental health as we went to the fully virtual model in the spring. But I'm curious, what are the greatest physical and mental pros and cons of returning college students to campuses this semester?
Yeah, that's a great question. And I am so incredibly proud of the work that our faculty did and the students that participated this spring in moving to remote and moving there quite quickly. We did the best we could given a tough situation and a global pandemic. But the truth is that isn't what we're built for. Part of our learning experience is that campus environment. And we know that we need that to have students fully engaged in that learning process. We know already from a campus standpoint, the drain on mental health services would indicate that sort of social isolation is not beneficial to the individuals that participate, but it's also not the best learning environment, right? So we looked as part of sort of the decision to try to get back to face-to-face, what all those obstacles are. I think mental health is a significant one. I think just the overall learning objectives. I mean, we have a lot of learning in the MUS that is hands-on, from welding labs to anatomy labs to you name it. That stuff sort of works online. We make the best of it, but that in-person experience, that social interaction, that ability to freely ask questions, to talk back and forth with your lab partner, to your instructors and beyond is a big part of it. And so, I think we tried to factor all of those pieces in. And in the end, higher education is still a choice. And we need students to make that choice, not just for ourselves, but beyond that, for our economy, for the pipeline. Overall, we have a role in serving workforce demands across Montana. And if we lose a generation of college students because they stopped out or they didn't re-engage because of the virtual environment or the online environment, it'll have devastating consequences, both to them as individuals, but also to our economy, to our workforce pipeline. And so we just tried to look at all of those things as they sort of fit together and how we can keep control of them.
Yeah, definitely. While you're discussing impacts to the economy and just impacts overall to Montana, we've obviously avoided any major outbreaks such as those witnessed in New York, Arizona, and Florida. But I'm curious regarding the impact on local communities with college campuses within the state. What arguments were there on both sides of the debate, specifically for allowing student populations to return in person or not this fall?
Yeah, we certainly got feedback on that. And we understand that in both ways. These communities are largely dependent on the institutions that we serve, or the communities that we serve with the institutions. And so that impact of having students in those communities is substantial. You think that that's huge in Bozeman and Missoula, and it is, but it's sort of the lifeline in Havre and Dillon and others. It's a major industry. And so the lack of that is really quite challenging. So there's certainly that piece of it. We understand the health concerns at the same time, and we certainly heard about that. But I guess practically speaking, and here too, we need the students to help us. But some of the most vulnerable populations probably shouldn't be out in the community, whether there's college students wandering around or not. Those probably need greater separation, isolation, to keep themselves safe throughout. The introduction of the college student to the equation, if in fact we can ask on them and call upon them to maintain social distancing, to behave in that manner, then it doesn't pose a tremendously larger risk than the general population does. And I think that's the calling that we have to answer, and that's what we're trying to balance in these communities. There is, that's just what everybody's working through right now, right? I mean, I think the country's working through it. What are the financial implications? What are the implications to those communities, their economies, and how do you balance that with the health and safety of those community members? We're trying to do that every day, and we're certainly very cognizant of that concern and working to try to keep our students safe, but at the same time, the communities that they're in safe.
Yeah, absolutely. Well, you mentioned that, you yourself and your team have engaged in talks regarding the pandemic since January, and I'm sure you fielded many questions in those past 5 months. But I'm curious, what's been the most frequently asked question that you've received during that time?
Well, it's probably waned since we made our announcement a couple of weeks ago, but without a doubt, are we going to play fall sports? Football has been the number one question asked. Somewhat kidding, but somewhat not. That one certainly was the headliner. Maybe before that, early spring, it was, what about Guns N' Roses and Kenny Chesney? All important topics. And back to your earlier comment, we're social beings. We like those things, and they're good community events. They're good public events. They too have dramatic impact on the economies that we serve in those communities. So it's a fair enough question, but yeah, that one ranked at the top, followed, I guess, not too far behind for how do we intend to keep everyone safe?
Yeah. All right. Well, lastly, Commissioner, I just have one final question, and I'd like to, if you're comfortable with it, go on a personal note. You've experienced COVID-19 firsthand. Can you briefly describe your experience with the virus?
Yeah, I got to experience it up close and personal. Early on, I think I was the 5th patient in Montana, but early on, early March, we had a board meeting in Dillon, and exactly the kind of things we're talking about, and exactly what we probably didn't know about then enough. But we had 150 people in pretty close quarters, moderate ventilation, and lo and behold, myself and I think 7 or 8 of my colleagues ended up sick from that meeting. Yeah, it was, I was sick. Certainly some people have had a wide range. I recovered at home, but it wasn't the most fun I've had, that's for sure. I had a pretty high fever and about as bad of body aches and that kind of thing as I've ever had. But more for me that it was a really busy time, and the energy was really hard to keep up. It sort of zaps you of your energy, but I'm over it now. I can taste and smell things again, and I'm back at it. So all is well, I guess. And for those that get to experience it, I wish them well too.
Yeah. Well, thank you for sharing that story, and we're glad you're sitting here joining us today.
Thank you.
And thank you for your time today, but that's all I had. Joe, is there any audience or follow-up questions from yourself?
Yeah, thanks, Brandon. And thank you, Commissioner Christian. We do have, looks like we have a question from Ashley. Is there a threshold at which the campuses would shut down?
So thanks, Joe. A good question. I think start with the reminder that we never shut down. We moved remotely, but for a lot of people, our campuses is home. And so we never cleared out the dorms. They remained open throughout. So at the heart of the question is there a threshold that we would move remotely again? And I guess I would tell you that unlike the decision we made in March, I really don't believe one size fits all. I can't really imagine that we would do that at a system level again. Our hope and our objective is that we would continue to manage the situation as best we can on campus. So, with sick individuals, when we get sick individuals, there's a high likelihood that we'll have to shut that class down for a while, as contact tracing will need to run its course and people will need to be isolated. But as they return to healthy status, I would think that we would return to in-person class. And then, you can extend that logic to a building or a facility or a program or a structure. Potentially you could even extend that to a campus if things got bad enough. But our goal would still be to manage the quarantine that's necessary to get people healthy, to manage the population, and then to reopen or remove or move back to face-to-face as we can. So I don't think it'll look anything like we did in March, where there's just a broad decision. And I also don't think there's a mathematical formula. The other part of our question is there a trigger? I don't think we've got a number in mind. I think it's just looking at all things that range from infection rates to hospitalization rates to quarantine facility capacity to student and faculty staff behavior. I mean, all those things are part of the overall decision, but I think it would be made much more on a individual basis than it would be a global one at this point in time.
That makes sense. Yeah, thanks for that. One last follow-up from me, Commissioner. There have been some questions and been some articles on whether universities are reporting positive COVID-19 cases. I was wondering if you could just walk us through this process from the Montana University system's perspective.
Yeah, absolutely. So I think one of the things that maybe some people don't understand is that our numbers, we're not an island of ourselves. Our numbers are included in the county numbers. Mm-hmm. So when the state reports county numbers and those brackets that they use, for myself, male in their 50s in Lake County, then that's reflected in the number. But we don't have we don't control the data on our end. And so what we believe is, and some of the articles that have been written about us, we believe that the keeper of that information and the best one to disseminate it is either local or state health officials. They also have the authority to do so under HIPAA and other things. If it's in the best interest of the state to identify potential pockets, clusters, then they have the latitude to do that, where we don't necessarily. So we don't want to dribble out bits and pieces of information that's incomplete. We think that it's best if our information is part of the county's information. We're working with those county health officials to absolutely identify anything that's helpful in managing it. And that includes if there's pockets on campus, then yeah, we should identify those. But it's not, like I said, it's not an island of its own. Our boundaries are very permeable, right? We don't know, we could have a student that's getting tested downtown that has no obligation whatsoever to report a positive case to us. We could have faculty, staff doing the same. Or we could have somebody tested on campus that isn't necessarily on campus. I was tested on a campus and had never been to that campus in the preceding month. So, you know, it's just not a nice, tidy package. So what we think is we need to work closely with our health officials and make sure that all of that information is getting out, and so that people can have it together and that it's useful. And if that includes identifying pockets on campuses, then absolutely. But we're working closely with health officials to try to iron that out now. And by all means, we want that information distributed, disseminated as best we can to be helpful. But there's also privacy concerns around that, where we have to be cognizant of that, and we have to let the county do their job. And frankly, I think that that's most helpful to them, because then we don't have people reacting to bits and pieces of information that aren't complete. When they know they have a positive case, then they start their contact tracing process, and they will identify those that have been in contact. And that's easier for them than everybody guessing, well, you know, I walked through a certain building on campus, so I'm going to call the health department and see if I'm sick. It just doesn't, it's not, it doesn't work like that. So we're going to get the information out. We are already disseminating that. Our numbers are part of the others. So there's no concealment. It's impossible. That's all happening by the county. They know everything we know. In fact, when we get a positive case, they tell us, we don't tell them. They're the keepers of the results. They hear about it first, and they would call and say, okay, you have a positive case on a campus.
Gotcha. Clayton Christian is the Commissioner of Higher Education for the Montana University System. Commissioner Christian, thanks very much for taking the time.
Thanks, Joe. Appreciate it.